Hi, good afternoon. This is York County Executive Ed Day, and we're here to, first of all, thank you for joining me on the latest COVID-19 update. We want to get you some updated. We're trying to break this down so people have some clarity as to what's going on, because it's ever-changing circumstances coming from the state, which makes it very, very difficult. Because there's still a lot of confusion, and we're going to try to devote this segment to addressing all that. Um, Obviously, there's a lot of changes that have been made, and it happens at the last minute. We don't get consulted here locally. It just ends up being on TV, and that's how we find out about it. And we appreciate your patience as we work through the announcements, because it really means they're usually finding out at the same time you are. There's when the governor gets on TV and says he's going to do X, we're hearing at the same exact time. Of course, the first person you call is not the governor. It's going to be me or one of the town supervisors or a mayor. And again, we don't have anything beyond what you just heard on TV. I'll give you an example of how frustrating this can be. The executive orders that come down are the ones we have to go by. There's whatever he may say on television, we have to go by the written word, because that's what the standard would be held to, and that makes sense, frankly. It's called official guidance. It's an emergency order, so this is all legal and proper. But often it takes hours, and usually it takes days to get the information in that form. So it's frustrating for all of us who are involved, and frankly, frustrating is not the word I want to use, but that's the one I'll use because this is probably a PG thing. And also I want to recognize John Lyon, my communications director. We used to call him the man behind the curtain, but he's developing his own personality now. So we just want to be very personal now. But I'll give you an example. Some of you may have heard, and especially if you're in a situation like I am, where you're planning a wedding. Some of you may have heard that the catering halls will be opening up somewhat. I mean, right now, I believe they're at 50% or 150 tops. They have to wear masks. There's no bands, no dancing. Not many people, obviously, happy with that. But he did announce an opening up maybe close to 2 weeks ago that he was going to loosen the rules up. And you can imagine I got phone calls from a number of the local catering establishments, all very excited. What's going to happen? And there was a few things that were on there, and that was the extent of it. We still, to this day, have not received anything as a follow-up. So we don't even know. And again, we have people who are looking to get married or have an event, a catered event, and they can't. And again, this is part of the frustration that it makes me shake my head. I just cannot believe. And I think this goes back to what we've talked about, that you cannot run a war from a bunker in Albany. You have to rely on your field generals and your units out there. Your units could be your health departments. This is where the ball is getting dropped all too often. So we're here to try to pick it up where we can. We try to get more information. We try to get it out to you as rapidly as we can. And part of the confusion we're now facing, again, rests with which eligible populations can be vaccinated at any given place is an approach I don't quite understand, nor do I agree with it. Seniors were relegated to going to pharmacies a couple of weeks back, I guess it was, and it was clear the pharmacies weren't ready for this. It was very clear they were not ready. So I'm going to give you the most recent New York State rules. They could change, obviously, so keep that in mind. But I'm going to try to simplify this as best as we can. Hospitals and healthcare workers and others from Phase 1A group get vaccinated at hospitals. Now, the group numbers are on the forward.ny.gov website. You can also go to our rockandgov.com website, and you can link to the state website from there. And so you can get this information from there. Am I qualified, I think, is a section that would have this information. So you can find it exactly where you would fit depending on what you do. If you're over 65 from the Phase 1B group, you get vaccinated at pharmacies, a physician network, or a practice group, or a doctor's office. So right now, predominantly, this is going to fall into the pharmacy. So you're over 65 years of age, you're Phase 1B, you right now are relegated to going to the pharmacies. Essential workers in the Phase 1B get vaccinated at the local health department. So for 1B essential workers, they get vaccinated over in Pomona by Building A. Now we got another wrinkle. We are supposed to be adding folks who have comorbidities. Um, on Sunday, now initially it was verbally conveyed, as we understood it, 16 through 64 was what the thought process was. When the website was updated by the state website, that forward.ny.gov website, it said all people. So now we find ourselves awaiting direction and information. We don't know. It's giving out, first of all, I think, a false sense of what's going on here. I think the perception many people have, especially our seniors, is that this new comorbidity group somehow jumped in front of them. That is absolutely not the case. They are people who are now eligible. They are going to be treated like everyone else is treated. They have to get their own appointments, where seniors don't have to do that. We have the Office for the Aging helping out seniors, and we have something else that just came in today, which I'm going to share with you, which is good news. So we're find ourselves again awaiting this. Now, supposedly this is going to be Sunday. The website's supposed to be opened up, and this is supposed to start on the 15th of February, which is Monday. So again,
and to specify there, if I can jump in here.
I'll take a sip of water. Thank you, John.
To specify, New York State has said that their AMI eligible website will be updated this weekend, I believe actually on Sunday, on Valentine's Day, to reflect people with comorbidities and underlying health issues being able to get appointments. That's not to say that there will be appointments available, because these state-run sites are booked, most of them through March. And when it comes to our local response, I think you have a little more to say about that.
Yes. So anyway, we're trying to find ourselves what's going on. What John says is accurate. They're supposed to be up to this website's supposed to be up to speed on Sunday. Supposedly supposed to start on Monday, but again, it depends on supply. It depends on the state. Again, this will be a state effort from what we can see. Once we get direction and information, and when it's received from New York State, will be added to our health department's COVID-19 webpage. So you'll have the information you need there to help you out if you are in that category where you have comorbidities, and we'll know exactly where you fit. But again, nobody is jumping a line here, and I particularly am addressing the seniors here, who I've heard from many of you who feel that that's what's happened. That is absolutely not the case. In point of fact, there is likely to be more attention being given to seniors just by sheer numbers we have right now who are registered. But what has made this even more confusing is New York State sent a health department vaccine specifically for seniors in the last few weeks due to local pharmacies not being fully prepared to vaccinate folks. This week we did not receive any allocation for seniors. The pharmacists have gotten those allocations. So we in the county health department did not get anything for seniors. So up in Pomona, we will not be doing any vaccinations there for seniors. The pharmacies right now are the ones who will be doing vaccinations for our seniors. New York's.
I do want to clarify, just for any seniors listening, we are starting to do second dose vaccinations for seniors who were vaccinated 4 weeks ago or so. So if you already received your first dose at our health department, you will receive your second dose here. What the county executive is saying is that we do not have doses, we don't have first doses to give out to seniors right now, but if you're getting that second dose, you're coming back to us.
Yeah, if you got the first dose, if you get your first dose over at Pomona Health Complex, as John said, you will be going back there for number 2. The general rule here is wherever you go for your first vaccine, you're going back to that same location again to get your second dose a couple of weeks, 2 weeks later, I guess it is, John?
4 weeks later.
Right. And there was one person who emailed me who expressed a concern. She had traveled to Florida, and for whatever reason, she got her shot over in Westchester County. For whatever reason, she was denied a second shot. Now, I was not speaking to her directly. I was speaking to somebody who was trying to help her out. Likely what occurred is going to Florida might have kicked in the required quarantine measures may have come in, so she was getting delayed. And the concern that that her friend had, who communicated with me, was that she'd have to go through the whole process a second time. Let's understand something. If you get delayed for whatever reason, let's say you are sick or you had to travel or whatever, and you're missing your second dose appointment, and they make it a week or two later, that's fine. There's no medical significance involved if you get delayed getting your second shot. So if you are one of those people at some point, because I've heard this question before where for whatever reason you missed that second dose and you're going to get it a week or two later, that's fine. All it does, all this would do, that circumstance would do, is delay you from reaching that 96% efficacy rate that that particular vaccine has. So New York State right now, okay, up right now, has instructed seniors to contact pharmacies directly to schedule appointments. The issue is that actually up until this week, we had no idea what pharmacies had the vaccines. We were getting the information, believe it or not, from you. We're getting calls from folks who got a vaccine shot at a pharmacy in Pearl River, in New City, wherever it might have been. They were calling us and telling us we did not hear from the state. So we didn't even know where these locations were. That has been corrected now. It took, as you can imagine, we were not a bunch of happy county executives on the line with the governor's people because, frankly, this is ridiculous the way this is going. So now we are getting this information, and you can find that. You go to the rocklandgov.com page, and John will put these links up in the comments section later on. Go to the county health department page, and you will see a section that says vaccine allocations. Is that correct, John?
Yes.
Vaccine allocations, and you click on that, you go right down the page, and you'll see all the different locations that are offering the vaccines in the all the different pharmaceutical locations that are offering the vaccines. So now, getting into trying to make this very chaotic system work, I think it's pretty much known at this point that the rollout of this particular vaccine effort has been near disastrous in many ways. It's been confusing. It has people in a panic right now, and it's really a sad commentary. But again, our job here locally is to try to make this work one way or the other. We ask patience from you because we only can obviously do so much of what we have at hand. So one of the things how we've been trying to help out is again understanding a number of our seniors do not have computers. They may not be comfortable navigating the internet, and they're much more comfortable with a phone. Frankly, I'm more comfortable with a phone, so I understand that. Our Office for the Aging has been very helpful here. They've been taking calls from Rockland residents, and we know it's been busy because a lot of people have been calling, they've been adding them to their database for assistance in getting appointments. So far, we have about 6,000 seniors who have been added to that database. In prior weeks, we were able to schedule those folks for vaccinations at our health department, but due to New York State changing the rules, we can no longer do that. But I'll add this one note of information and insight. There is always a possibility we may have a need in our world here to vaccinate seniors at a more rapid rate, and we may have the vaccine supply to do so. One of the things that the governor's people have told us now is they're looking to give us a little more authority and maybe not lock us into what their rules are. So when that happens, I'm going to look at the list of people we have and see where the need is most defined. And right now, clearly the need is defined for our seniors. So that's what I'm looking at right now, whatever we need to do. And if we may get it okay, if we get the okay to do something at the health department on our own, we'll do it. So there's always a possibility that even though you're not going to the health department right now, that could change in a week or two. You may end up being called up there. And of course, we'll be giving notice out to that. We also have the list, so we'll be reaching out to you to tell you. So our Office for the Aging is working with our local pharmacies also. They were overwhelmed early on, the pharmacies. They came into work and they couldn't use their phones. They could not get calls coming in for prescriptions. They were just completely overwhelmed. So our Office for the Aging saw a need where we could not just lend a hand to the pharmacies, but also offload some of that workload and get to you. So we'll be able to get you on a list so we can reach out to you later on. We're sending our staff and volunteers who are also going to these pharmacies to assist them on these vaccinations. So some of the people you're seeing there are your neighbors who are volunteering, and also members of our Office for the Aging. We also have had a number of different departments in county government have all joined together to try to work on this to make this to address the failings that we had when the state's original rollout of this vaccine. So we know these local businesses have small staff and need the help, and we're trying to provide the help there. And at the same time, be able to get seniors to understand that we have your information. Once we get the supply in, we'll be vaccinating you, and you can at least stop having to call over and over again. We did a robocall, was it yesterday, John?
Mm-hmm.
Did a robocall yesterday to the numbers that we had. Most of you probably got that call, and basically it was just a reassurance that if you're getting the call, that means we have your information. So, you know, you're in a good place right now as it relates to that. It's really it's a waiting game right now. It's all about supply. You know, as we saw early on when the pharmacies were originally listed on the New York State website, they were overwhelmed with calls. We want to avoid that and avoid the need for you seniors to have to call dozens of pharmacies day after day after day searching for an appointment. So that's another reason why we've interjected ourselves into this. And the pharmacies have been very good. They've been very cooperative with us, and that's where we're going. So our Office for the Aging right now is still taking calls for seniors at 845-364-2110. Again, 364-2110. But please know they're extremely busy. We've expanded a number of phone lines. We've also, as I said earlier, we've brought in additional personnel. So please be patient if you're trying to call. But know this, once we get you registered, all you need to do is wait for a call. And to emphasize this again, because it's important that people hear my voice on this, because there's enough of anxiety out there right now, and it's not necessary in many cases. If you have spoken to an Office for the Aging team member, not if you left a message and were not called back, that does not count. If that happens, if you left a message, you're not called back within a couple of days, maybe 3 days tops, then you should call back. But if you spoke to a member of the staff who took your information down, you don't need to call. You are on the list. You'll be called when, the supply starts coming up to a point where we can do this. This is a very slow distribution, as you know, to the vaccine by New York State and the federal government. It may take weeks or it may even take months. The governor already has said he's looking at 6 to 9 months to complete this entire process. So I just want you all to be understanding of that. And again, what this is about today is clarity. It's not about blaming anybody. What's happened in the past has happened. We can't change that. And it's not going to do us any good, including me or you, to focus on what happened in the past. What we want to do now is chart a path forward so we can get you the vaccines that you need to get, and that's where it comes down to. So the bottom line is, until more vaccines come in, as I said, from the feds and from the state, we're going to have a limited effort here, but we will advocate locally here fiercely for you. We've been doing that here already. I do have some numbers I'm going to give you a little bit later on, is to show you the effect, not just of the advocacy of myself, my fellow county executives in the region, but also many of you who picked the phone up and called and demanded better treatment for Rockland County. And I thank you for your efforts, because that's the thing that people in Albany listen to. They start hearing people calling, angry and demanding what's right. They start taking notice. So I want to thank you for that. And I'm going to give you the results. The end of this will be all the good news, by the way. I'm going to give you the results in a couple of minutes. I want to update you on the latest numbers, because they are positive too. Please keep in mind that the data that I'm sharing with you is publicly available on our COVID-19 dashboard on our website at rocklandgov.com. As of yesterday, there were 1,743 active cases here in Rockland, 1743. Active case described as someone who tests positive, could be fully asymptomatic, may not even know that they have a positive until we call them, obviously. They may feel perfectly fine. They may have the sniffles. They have a fever. That could be all there is to it. But that's what we have right now. And this is the positive results within the last 2 weeks of the Rockland Health Department. The number peaked to near 3,000 in early January. That means right now our positive cases have nearly been cut in half. That's where our experience is right now, from over nearly 3,000 to 1,743. So we're approaching a 45% cut right now. And it's increasing ever since. So what I urge you to do is, again, we've said this a million times on these broadcasts, that we're making our best bets here. The best bets we have, is, again, social distancing, wearing a mask, washing your hands. Those are the things that make sense to stop any virus. So obviously, please keep doing it, because that's, we just added a tool to our toolbox. Those of you who've been following this broadcast since we started, Remember saying we did not have vaccines in our toolbox. Now we got them in the toolbox. The problem is the toolbox is still closed. And we only can open it up one little bit at a time and get some vaccines out of there. But we're going to get there, all right? And together we're going to bring this number down even further. Hospitalization rate, again, a very important indices for exactly what we're dealing with here in Rockland County. Was hovering around 100 people hospitalized since the end of December, but a couple of weeks where it dropped a little bit, peaked at a high of 107 on January 10th. Now the good news is that as of today, it has dipped down to 59, which is a significant drop from where it was before. That is absolutely well within the ability of our hospitals to handle it. And again, critical to this effort that we have here to knock this virus out of our lives is to make sure our hospitals can handle their load that may come to them. And it was tough at the very beginning of this mess. It got much better, but now again we're seeing the hospitalization rate again down about the same number, about 45%. So we're doing well. An additional number I can share with you today is the percentage of Rockland residents who have received their first dose of a COVID-19 vaccine. That percentage is 8.78%. Now that compares to a statewide average of 8.23%. So we are tracking a little bit higher than the state average. The number was provided by New York State. It includes data through Sunday, February 7th. That's how up to date this is. And New York has pledged to send us this number regularly, and we're also working on add this information to our dashboard so you can see it too. Additionally, I tend to be a suspicious person. Telling me that our vaccination rate is at a certain level tells me how many people are vaccinated. It doesn't tell me where they're vaccinated. If our people are running up to Potsdam or going to Westchester, I'm not a happy guy. It's as simple as that. I want our people to be able to come to Rockland County as much as possible. So we requested a zip code level breakdown of this data so it can help inform our outreach and communications efforts. In addition, know a little better as to where you are getting vaccinated. The number also speaks to the power, as I said, of your voices and the advocacy. Weeks ago, when we received a mere 200 doses, when we requested 2,000, and again, I was very clear about this, Rockland County has nearly 11% of its population has tested positive for COVID. Again, that doesn't mean they're sick or infected, but 11% is a high number. We are in fatalities, number 2 county in the state of New York on fatalities per 10,000 people. That's where we are. And we were very clear with Albany that what was going on was absolutely unacceptable. But I want to say this, thanks to our work, and I mean it's a collective effort, Rockland County as a whole has been receiving at least 2,600 doses of vaccine the last 2 weeks, and our expectation that this level and allocation will continue to grow. And just to give you a sense of it, for our received vaccines only at our local Department of Health, the first 5 weeks received only 1,200 doses. In the following 4 weeks, including this week, we have received 5,200 doses in only 4 subsequent weeks, and we have doses that went to pharmacies and hospitals that are not part of that number. So we're probably close to 6,000 doses that have been received in Rockland, which is 5-fold over what we had before we started looking out for ourselves and defending ourselves. And again, I will always do that. I'm not afraid of a fight. I'm not concerned about that. If it's the right thing to do, we're going to do it here. So also, one more thing is that, and this is important, you know, like as I said earlier, we recognize that many of our seniors are not comfortable going online, but going on phones is very arduous. It's very difficult to expand phone capabilities within the structure we have here in Rockland County, and we're doing what we can do. We've been working on a vaccine wait list that seniors can go on if they can get online. So right now, in addition to the phone number 364-2110 for the Office for the Aging, residents age 65 and over only, can sign up at the Senior COVID-19 Vaccine Waitlist by visiting our Health Department's COVID-19 page at rocklandgov.com. So it's up, it's live right now. So if you have not been signed up yet, as a senior, again, I emphasize, if you're not 65 or over, do not go to sign up, okay, please. This is something, right now, the cohort of senior population. And I'll be very, very honest. The highest numbers we have right now are seniors who have not got their vaccinations. The fact of the matter is seniors are most at risk. Obviously, they have comorbidities too. They're even more so at risk. But seniors are, for lack of a better way of putting it, the target audience for this dreaded virus. We are trying to do the right thing for everyone, but balance it with common sense and some compassion here. So please don't muck the works up by going on this site if you're not a senior, okay? So anyway, you can go to the site now if you like, and then you can sign up if you are not on. Again, if you've called our health department, or our office for the aging, and you spoke to somebody and gave them your information, no need to do anything other than wait for that call. If you left a message and you have not gotten a call back, and you want to go to this website, go right ahead and do it. It's a good idea. So we're at the end. Is this link up yet, John, or at the end of the day?
I do not know if it will be posted for sure by the end of the day. It may already be up. You can access it through the County Department of Health's COVID-19 page. I will put a link directly to it in the comments section for everyone once I know for sure it is up. Okay, very good. I'm going to clarify that before we went off air, because if it was not up for another half an hour, you'd get mad at me, and I wouldn't blame you. You know. But anyway, I want to thank you all again for what you did. And look, it's going to take time to get everybody vaccinated, and a lot of what's going on now is anxiety, and until you see more positive things happening, that anxiousness is going to be part of you. All I can tell you is that the end of this is going to come, and I have absolutely no doubt we're going to get what we have to get there. I hope you can believe me to some extent, to maybe calm down a little bit. I don't know what else to say at this point. We're going to have increased vaccine supply. There's no getting around that. We have 2, Moderna and Pfizer are pumping it out now. Johnson & Johnson seems to be around the corner. So we're seeing at the national level, which feeds into the states, an increase in supply. That is not going to go the other direction. That's going to keep increasing, keep increasing, keep increasing. It'll be getting out to the states, getting out to us, okay? All we concern ourselves with here in Rockland County out of this office is that whatever crosses the borders of New York State, I want to make darn sure we are getting our fair share. I'm not concerned about whatever conversations the governor has with the president. They will deal with what they have to deal with. I need to deal with the governor and his people and get what we deserve here. And I will keep repeating the motivating factors, the data and the science that the governor consistently quotes. I am quoting the same thing to him, that with the infection rate we have here in Rockland and with the fatality rate we have here in Rockland, we deserve a lot of attention, and frankly, we deserve either a lot more vaccines so our health department can start pumping it out, because they can do 500, 600, 700 a day if need be for vaccinations. And if you're not going to do that, then get us a state site down here in Rockland County. We have the plans laid out. We had them laid out in December. So we're ready to go here in Rockland County. We're battle tested. We've done this before. We're trained, and we know how to do this. So again, my point here, before I get too off on this, is that we're going in the right direction. Supplies will increase. With increase in supplies, be less busy signals, be a little bit easier to click on. You know, right now you're going online to the various websites. It's like buying concert tickets for Bruce Springsteen. It's very, very difficult, and I get that, all right? So in any event, again, we're going to get there. We're going to keep you updated as best as we can. Please be patient with us, too, because, again, we're reacting to what we're getting, and often we get curveballs thrown at us, and I was good hitting fastballs, curveballs not so much. But be patient with us, too, and we will get you as much clarity, as much transparency, as much honesty into what's going on as humanly possible. So with that, some of you are going to be off for a couple of days, either Monday or Friday, and you have the weekend coming up. We got some snow, I think, planned for Tuesday. I know we're getting sick of that too, obviously, but in any event, whatever your travels bring you to over the next few days, take care of yourself, be well, and until next week, it's County Executive Ed Day signing off.